Greetings from Indian Journal of Anesthesia. I, Dr. Kiran Mahendru, will present an article published in the June issue of the IJA. It is a validation study on Hindi translation and cultural adaptation of the quality of recovery score 40. Now, good quality of recovery is associated with satisfactory physiological and functional recovery. It is multifaceted and subjective. The quality of recovery 40 score has been used worldwide to assess the global patient recovery, and it has been validated in many surgical cohorts. It evaluates the recovery in 5 dimensions of health, which is the emotional state, the physical comfort, independence, psychological support, and pain. It is a patient-centric tool which needs to be filled by the patients, therefore needs to be in patient's local language. The primary objective of this study was to translate and culturally adapt the QoR-40 score in Hindi language and to test the validity and reliability of the translated version in patients undergoing cancer surgery. Ethical approval was attained for this study and was registered under CTRI. It is a validation study in patients above 18 years of age, operated for malignancy under anesthesia, and who are able to read, speak, understand, and write in Hindi language. The patients with cognitive dysfunction, significant history of substance abuse, and refusal to give consent were excluded from the study. First of all, forward translation was done for the questionnaire, in which the questionnaire was translated from Hindi to English, which was done by 2 native Hindi-speaking translators who were senior Hindi translators employed in a central government institute to translate documents and notices. An expert committee was formed, which included a senior surgeon, an epidemiologist, a professor in nursing, 1 senior Hindi translator, 1 anesthesiologist, and 1 pain and palliative care physician. The committee formulated a consensus version by combining the 2 forward translations and removing the challenging phrases and resolving any discrepancies found during the translation. This was followed by backward translation, where 2 experienced English translators, who were college lecturers, were unaware of the objectives of the original questionnaire, translated the consensus version back from Hindi to English. The original committee again resolved the differences of this pre-final translated questionnaire with the original questionnaire. Any question that looked objectionable or unfeasible or affected by the privacy or sentiments of the patients was also discussed and removed at this level. This led to a finalization of a pre-final questionnaire, which was applied to 25 randomly selected postoperative patients. Feedback was taken from these patients, and based on this, changes were made in the pre-final version to create a final version. This version was checked for reliability and validity by testing on population of patients operated on for malignancy. All the enrolled patients were asked to fill this translated version of QoR-40 first in the preoperative period, a day before surgery. Following this, on the postoperative day 3 in the morning and then in the evening. Pain scores in the form of visual analog scale were also assessed at post-op day 3, and total length of hospital stay in days was also recorded. The sample size calculated for the study was 400. Pearson's correlation analysis was done for construct validity, and the reliability in the form of internal consistency was assessed using Cronbach's alpha value. The content validity was assessed by the time taken to complete the questionnaire and number of patients who thoroughly answered the questionnaire to determine the feasibility. A Cronbach alpha value of above 0.7 suggested that the questionnaire items are adequately interrelated. All the 400 patients completed the questionnaire, but the results were derived from responses of 350 patients who have completed the questionnaire on the post-op day 3. 50 patients were excluded from the results because of inappropriate responses, or they were on mechanical ventilation beyond post-op day 3, or because of hemodynamic instability, they remained in the ICU beyond post-op day 3. Now, as you can see the reliability assessment, the Cronbach's alpha value was more than 0.7 in all the parameters. That means there was internal consistency. And as you can see the validity assessment, the correlation positive, there was a positive correlation of each subscale with the total QoR-40 score on post-op day 3, the morning scores. Also, you can see a negative correlation can be seen between the recovery score with the pain scores and the length of hospital stay. The independent completion of the questionnaire was seen in 98% of the patients, and time to complete the questionnaire was 3.8 minutes. It was easy to understand in 90% of the patients, easy to complete in 86%, and the patients can relate the questionnaire to their recovery in 92% of the cases. Therefore, there was satisfactory reliability, validity, and responsiveness of the translated questionnaire in patients undergoing cancer surgery. The original questionnaire contains 5 domains, and the score is a most practiced instrument for assessing the recovery in all the surgical cohorts. It is a close-ended, self-administered 40 questions with points given on 5-point Likert scale. As this question is self-administered, it needs to be written in the language the respondents can understand. The Cronbach's alpha value revealed good internal consistency of this translated questionnaire. Assessment of the validity showed that there was negative statistical correlation between the recovery score with the VAS score and the total duration of hospital stay. So there was a good construct validity. The acceptability results of the translated version have shown good feasibility and understanding of the translated items. And most of the patients found this questionnaire to be simple and easy to answer. The time taken by the respondents to fill out the questionnaire was 3.8 minutes without any assistance, as compared to the original questionnaire in English, where the mean time taken by the respondents was 6.3 minutes. That means it has better comprehensibility. The only limitation was the inference of these results cannot be applied to patients undergoing other types of surgery like daycare, minor surgeries, or emergency procedures. Therefore, the Hindi translation of QoR-40 questionnaire is a valid and reliable version of the original questionnaire in English to assess the quality of recovery in Hindi-speaking patients after cancer surgery. This questionnaire, the translated version, is published along with the article. Thank you so much.